All running now. So welcome and thank you for attending today's meeting on our infectious control plan for Camp Cuyuna this summer. The 2020 summer camp staff and the Scouts BSA Camping Committee have been busy creating contingency plans because of COVID-19 to make it a fun and safe summer for all. We reviewed current CDC guidelines, have consulted with local healthcare professionals, and have attended many webinars from both the National Council and other camps, both in Minnesota and Wisconsin, to establish a plan being presented today. Like everything concerning COVID-19, this plan is subject to change and will most likely be offered based on continuously updated CDC guidelines and regulations from local, state, and federal government. We will keep you informed of these updates and changes at least bi-weekly between now and camp. Our goal as of right now is to provide updates as of May 15th, May 30th, June 15th, July 1st, and July 15th. It is often said that the best offense is a good defense. This starts with those sick not coming from camp. Parents should not send their scouts to camp, or leaders should not attend to camp if they have in the past 72 hours prior to leaving for camp have had a temperature over 104 degrees Fahrenheit, have vomited, have had difficulty breathing, have had diarrhea, or have had in contact with somebody that has been known to have a communicable disease. Those at-risk populations should not come to camp this year without first consulting with your personal healthcare professional. This would include anyone over the age of 65, anyone with asthma, or other respiratory illness. We recommend that you social distance while traveling. This would mean don't pack 3 people in your back seat instead travel with only 2. If traveling by a bus, only put 1 person per seat. All passengers should wear face masks while in the vehicle. Each participant should bring their own supply of face masks. It is recommended to bring at least 1 per day. These should be worn when the scouts are in group settings or at least not 6 feet apart. Scouts and leaders should wash their hands frequently. This means before they leave home, after they arrive at camp, before entering program areas, and before and after they eat. We recommend that only 1 person sleep in a tent. If more than 1 person is in a tent, we recommend that siblings are tent mates wherever possible. In cases that more than 1 person should be in a tent or is not possible due to a scout not comfortable for being in a tent by themselves, we recommend that there's no more than 2 to a tent, and we recommend that they also don't congregate in the tents like during off time, hanging out, playing cards together, etc., because outside is safer than inside. In the case where units or more than 1 person is also in a tent, we recommend they sleep head to toe instead of nose to nose. Your unit will also receive an arrival time that will be staggered throughout the day to help minimize lines during the medical recheck time. Good hygiene practices while you're at camp will go a long way to help preventing the spread of diseases. Sanitizing latrines, picnic tables, hand washing frequently, proper food handling, and dishwashing are just a few of the focus areas. We'll also be working on a twice-a-day restroom cleaning schedule versus only once a day. I'd now like to hand it over to our Vice President of Program, Lisa Vasquez, who will go through some programming changes that we have in mind. Lisa?
We will be limiting the size of merit badge classes, and signups will be on a first-come, first-served basis. Most classes will be limited to 10 scouts. Eagle Trail will be limited to 20 scouts, and both leatherworking and woodworking will be limited to 5 scouts each session. We will have a waiting list for all merit badges so that if demand is greater than supply, we can work to meet that demand. This may mean opening up additional sessions, reassigning staff, or recruiting volunteers to help open up new sessions so that everyone that wants a particular merit badge can be accommodated. This may not always be possible, but we will do the best that we can. The requirement for life-saving cannot be met while social distancing. Because of this merit badge will be taken off the roster for this year. Some requirements for swimming will also not be able to be met. We are only allowing 1 unit at the waterfront at a time for swim checks and open swim. There will be a sign-up time, so each unit has an opportunity for a time. We are changing the water carnival and Olympics so that a unit, patrol, or scout can participate without being in a large group at once. We encourage each unit to do both a flag raising and a flag lowering ceremony each day in your own campsite. At least once during the week, each unit will have an opportunity to be a part of either a flag raising or flag lowering ceremony in the camp patrol grounds. We can fit 65 people on benches in the council ring and be 6 feet apart. We can fit additional people around the edges on blankets and or lawn chairs. Some weeks we will be able to do the campfire programs at the rings. In larger weeks, like week 3, we are looking at having a traveling campfire program where the staff breaks up and travels round robin style, conducting the program in each unit's campsite. Unfortunately, we will not be able to do friendship fires in 2020. We do encourage your unit to have a program on Wednesday, and the staff will travel to each campsite to visit and have a special program. Staff members will come to your campsite to lead chapel service on Wednesday night. Unfortunately, the Gaga Ball pit and human foosball court will be closed in 2020. Giant chessboard and Giant Connect 4 will be available as long as social distancing guidelines are followed.
Only 4 individuals will be allowed in the trading post at once, in addition to the staff member. Remaining customers should wait outside, and as one person leaves, another may enter. Face masks should be worn while in the trading post. If it becomes necessary to travel into storm tubes or storm shelters, face masks should be worn while in the shelter. We will have extra supplies available if the scout forgets theirs at camp, and we will sanitize these areas after use. We ask that only 1 leader from each troop attends each day for the meeting portion of the Scoutmaster Coffee, except for Thursdays when I will be there to do the fireside chat. Each unit leader is welcome to come by for a cup. We will also be pre-grilling the steaks this year, so we allow for social distancing and not gathering around the fire pit for the Scoutmaster steak fry. So when should face masks be worn? In short, when a scout or a leader is in a situation where social distancing is not happening. This is when people are not 6 feet or more apart. This will most likely be happening when you're traveling to and from camp in a vehicle, during merit badge classes, and while in the trading post. They should also be worn while you're cooking, serving, or cleaning up after meals. Doctors have told us that the mask, unless they're the N95 mask, which are for healthcare personnel, will not keep us safe from catching the virus, but what they do is help those that have the virus but no symptoms from infecting others. Scouts will be encouraged to decorate and customize their mask, and we'll even have some sort of contest for this. Between sessions of camp, the staff will disinfect campsites, community surfaces with 1 to 10 bleach solution, including latrines, tables, restrooms, and shower facilities. We'll pay attention to the community services, including faucets, handles, light switches, and doorknobs. The unit should do the same a couple times each day throughout the week, and the same will happen in program areas between each session. Scouts and leaders that show symptoms will be isolated and quarantined. Those that also were in close proximity, such as tent mates, patrol leaders, and tent mates. The camp health officer will make a determination on whether those scouts and leaders should remain in camp after consulting with healthcare professionals. At this time, I'd like to open up the question and answer portion of the meeting. If you have a question, just please unmute yourself and we'll answer any questions that you may have.
Say, Ray, I just wanted to reiterate, you broke up a little bit, but fever is defined as 100.4 Fahrenheit or higher.
Correct. Thank you, Don.
Hi, this is Jim, and I'm just curious what would happen if the state couldn't attend camp? What would be the policy on refund?
I'm sorry, Jim, you broke up and we did not understand your question.
I'm just curious what the refund policy would be if somebody couldn't attend camp because they fit underneath like the vomiting, they got sick before camp.
If they don't show up to camp at all, we'll give a full refund. If they have to be sent home for quarantine reasons during camp, it would be a percentage based on the number of days that they're there.
Okay.
Should we be having a questionnaire and taking their temperature before we leave?
Yes, there is in the packet that was emailed out before, and we'll re-email out it again. There is a self checklist that we ask everyone to do prior to leaving for camp. And we'll redistribute that several times between now and camp, but it is in the packet that was emailed out ahead of time. The last page.
So you said no one with asthma can go to camp?
No, it's where we said the people that have asthma ought to check with their healthcare person first and get their advice.
Okay.
Part of the
Don, do you have any recommendations on that as the doctor?
Yeah, it would have to be on a case-by-case basis. So if there is any concern with an underlying condition that the child has or the adult has, such as asthma, you should consult with your provider anyway. Let them know you're planning on going to camp. Let them know about the safety precautions we're taking as well, because it could make a bit of a difference in their decision-making also.
Oh, my concern is with the physicals. I have mine coming up in a couple weeks. What if they aren't giving physicals at that time?
I can
Don?
take that one, Ray. Yeah. Most providers will usually be fairly lenient about a physical. If a child has had a physical within the past year for school or sports or something else, we can use that physical in most cases as part of that. We may need the additional history form to review again. So that would be up to the individual provider and the particular child. For an adult, it would be up to the adult provider as well to make that decision as to when they last had a physical. We also, some of us are doing virtual visits, and in some cases, for certain people, we may be able to do an approval based on a physical in the past, plus a virtual visit that we'll do over the screen. So that may be possible as well.
Dr.
In
Patel, are they
addition-
calling people about the physicals? Because I think mine is like May 15th or around that time. Because mine's at Mankato Clinic.
Is the clinic calling you, or?
Yeah, will they call or do I call them or how? Like, will they
Well,
get-
yeah, you'll need to call and find out first. I'd recommend you get a physical for your child if you haven't had one in the past year. We are doing them. We're encouraging them. For certain conditions, we may recommend a virtual visit instead of coming into the clinic. I can speak for the Mankato Clinic on that. I'm not sure what Mayo is doing at this point.
We also expect further guidance from National on the medical forms next Thursday. There's several options that they're also considering, one of which if you had a physical last year, let's say in May, so it typically would have been expired because it's in 12 months, extending that for a couple months. But they have not done that yet, and we should get a clarification and some recommendations next Thursday. So we'll shoot that out with our next update that we promised at the beginning of this webinar.
One thing too, to piggyback off of Jim's comment, or question, we are asking that units and scouts and leaders register by June 1st. And if at any point, before or after that, because of COVID related things, the scout or the leader does not want to attend, you will be reimbursed for that at any point before camp.
I think that makes a real easy decision for people who are questionable and saying, hey, I don't know if I should go to camp. At least you can say, you know, I really appreciate that it's open to back out and caution on that side. So, thank you.
One of the questions on the chats is, bandanas acceptable for mask? Yes, bandanas are great. And actually, that is exactly what we're going to be doing for the extras if in the storm tubes, if someone forgets theirs. We're going to buy some bulk bandanas and some rubber bands, and we'll be emailing everybody out some plans for making your own mask. And one of those is that simple bandana folding using of rubber bands to make a mask, and that is perfectly acceptable. It is important that if you think somebody is coming to camp to register, as Lisa was saying, by June 1st, because here's what will happen June 2nd. We will look at the numbers of people that are planning on coming to camp and start looking at bottom line of saying, can we financially afford to run camp or not based on the numbers of people coming? And make that determination at our June 14th board meeting. If for some reason, for instance, let's say the shutdown from the state has not ended by then and we're still at stay-at-home orders and we cannot run camp, I can tell you that the impact of the bottom line will be $60,000 because we still have expenses for camp that we can't not have. Insurance for camp, electricity, a ranger, all of that kind of stuff. If we have 175 kids go to camp, we still lose $60,000. The break even is the 350 that we've been running. So that's where we will be looking as a board. We want to run camp if it can be done so safely. We want to run camp if it can be done financially viable. But if 50 kids are saying they're going to come to camp, we will be losing over $100,000 at that point, and it will not be financially viable. So that having people sign up is important.
If you are a unit that pre-registered to and you have a change of numbers with that, those funds can either be redistributed or they can you can change those numbers now as well before June 1st.
Yeah, unlike past years when we said after the early bird deadline, you know, there's no refunds except for a very select number. We waived that, and because of COVID-19, so we can help ease people's minds. But keep in mind, don't have people just sign up that are not coming, because we're going to make some, granted they can change their mind, but we're going to make some decisions based on those numbers. And if we think there's 200 people coming, but only 100 show up, there's some pretty severe financial circumstances for that. And we'll refund like we promised, but it will hurt. Other questions?
Any thought on the drinking fountains? Are you guys gonna require the kids to fill their water bottle that way, or can they drink from the drinking fountains? I mean, that.
We're going to recommend that people use their Nalgene bottles or what have you, but the drinking fountains, I'm assuming you're just talking about the ones that's on the latrine?
Yes.
Yeah, just wash them several times a day.
Okay.
I'm just curious about the OA conclave, the spring conclave, no, summer conclave, how that will look as far as similar
So-
to what some of
I
these-
don't have exact answers for you, other than we moved it back a week. And I've already in conversations with Paul Taylor to ensure that we can do social distancing guidelines throughout. That may include, and this is, I'm not saying we're doing this because I don't know, but it may include doing the ceremony in the main council ring because it's bigger and we can social distance even. It's going to mean smaller work crews, and it's also going to mean work that can be done that you're standing apart and not close together. So we are looking to ensure that things are safe and are following the guidelines, but I don't have exact answers for you at this point. Any other questions?
I just want to make a comment. This is Don. I think this is a very well thought out plan. I want to thank the council members who helped put this together. I think it's very well thought out, follows all the current guidelines, but like Ray said at the beginning, they may need to be altered. We don't know how, because none of us know what's going to happen, but I feel very safe that it's a great plan, and I'm hoping camp can be held.
For those that don't know, Don is the pediatrician at Mankato Clinic, and he's been our camp health supervisor for years, and then writes the standing orders that our medical officer uses. Our medical officer this year is Heidi Malling, who is a doctor herself. So that's an added bonus we have for camp. We talk about health and safety as we have an MD on staff that can help those that need it. If there's no other questions, thank you for taking part in this meeting. I hope to see you all at camp this summer. And we will have several of these, as I mentioned, kind of every 2 weeks to update you on things as they come up and keep you informed at camp. You will tomorrow get a copy of the written plan again, a copy of this presentation, and the face mask, how to make them PDF. We ask that you share this with your unit's families so that they know what's going on as well. And if you as a troop would like me to lead a session, would be happy to do that as well. So just let me know and we can help. This concludes this evening's program, and I appreciate your time here this evening. Thank you.